Trauma care isn't just about how to respond when something bad happens. University of Maryland working to expand the expertise in that field. Joining us now is Dr. Shailvi Gupta, University of Maryland. You're starting a trauma science program in the fall, and you're lucky enough to head it all up. Good to see you.
Yeah, thank you. Thanks for having me.
We are really fortunate in Maryland. I feel like we're more advanced than most, and we do the job well right now.
Very well.
Describe the difference or what we're able to do that when you travel the world you don't see.
Sure. Shock Trauma Center is a center of excellence, to say the least, and it's led by Thomas Scalia. We have a trauma system where anything you need to take care of the injured patient, we got it. When you think about pre-hospital care, when you think of the MIM system, which is the Maryland Institute of Emergency Medical Services, et cetera, we are so advanced in what our pre-hospital system does, what we are able to do when a patient comes to the hospital, when it comes to blood transfusion, what we're able to do operatively, post-operatively, and get patients out the door and integrated to society. Other places aren't so lucky. When you think about the burden of injury, the WHO quotes 4.4 million deaths globally per year, and the numbers are probably higher than that, 90% of which happen in low and middle income countries, places that do not have trauma systems, so places like various countries in Africa and Asia, et cetera, they don't have trauma systems. And so because they might not have an ambulance system, because they don't have pre-hospital care system, people are dying because of the resources that they have and maybe the knowledge that doesn't exist right now.
I feel like we are really forward thinking. I mean, we have young kids now who have tourniquet training or stop the bleed and those kind of things.
Correct.
And I feel like your program now, and I'll get you to talk a little bit about what's going to happen at University of Maryland, is pushing that forward for those already in the field.
Yes, and so like, for example, my boss and mentor, Thomas Scalia, he has changed the game when it comes to trauma care in a very progressive way. So he pushes trauma care in any way, shape, or form that he is able to, and it's amazing. And so spreading that mentality, that shock trauma way, that things can happen, things can be better, how do we organize things, how do we train people with that same knowledge, it just kind of excites us because, you know, it's a real way that we can try to improve trauma care globally.
He was saying in the video, speaking of Scalia, he said two things. One is that we all have a role when it comes to trauma care, and I found that really profound thing to say. And he also says that we don't put enough focus on it. So we see it. We see it here in Maryland, but globally, in a wider spectrum, we don't put enough focus on trauma, which seems odd to me.
Well, it's interesting. Even our trauma fellows, who are some of the most talented physicians, you know, in the country, they're trained very well in clinical trauma care. But when it comes to knowledge about trauma systems and what happens when a critically injured patient in the field gets injured, what happens from there, people don't know too much about that. So spreading that knowledge, and everybody has a role. So before the patient comes to us, there's a whole EMS system, a whole pre-hospital system, and if that isn't done well, then they come to us, maybe we can't do anything about it. And so there's just so much that happens in the breadth of trauma care. Everybody has a role, everybody has a role. And so if we're able to broaden people's perspectives about what trauma care means and kind of have people be educated in a different way, I really think we can improve trauma care, really.
Tell me about the program that's going to begin.
Sure.
First of all, who you're targeting to be part of it, and when someone walks away from it, and it's virtual, so they'll be all over the world. When they walk away, what's the knowledge they come away with?
Absolutely. So this is a 2-year online program, and we are targeting people, genuinely speaking, who are passionate about caring for the critically injured and what that could mean. EMS providers, nurses, physicians, locally, nationally, internationally, and we want people to walk away with understanding trauma from a public health point of view, understanding that trauma is a preventable disease. There are ways, think about gun violence, think about injury prevention, think about the advent of seatbelts and helmets and how many lives that saved. And so we want to put trauma in that perspective. So there are courses that are based on that. There are courses that are based on looking at trauma systems around the world. For example, the UK, Europe, they do trauma differently, not behind, not bad, just different.
Just a different way.
Just a different way. And then we look at clinical trauma from head to toe. We have the opportunity for people, if they want to come rotate with us, they're more than welcome to, but we didn't make that a requirement because we wanted international people to come and join us. And so again, it's for anybody who's passionate about taking care of the injured patient and wants to increase their knowledge on how to do so better.
For folks who that might be too advanced for them, just real quick, a minute left. Taking those CPR, tourniquet, stop the bleed classes, how important is that for the average person to know?
It's important. I mean, I'm not going to say it's not important.
Sure,
yeah, it can be helpful. And when you look at it from an international perspective, places that don't have ambulance systems, they train lay people in how to bring a patient to the hospital, like put a tourniquet on and bring them, because that's all they got. And so it is important. It's quite important.
All right, we'll be looking for the new program. Thanks for coming by.
Yeah, thank you.
Good
I appreciate it.